Good morning, everyone, and thank you for attending. It is now 10 a.m. on the 15th of September 2025, and this is the Healthcare and Overview and Scrutiny Committee. Zach, is there any apologies?
Good morning, Chair. I've received apologies from Councillor Statham and Councillor Kelly.
Is there any declarations? Okay, I'd like to approve the minutes of the meeting held on the 31st of July 2025. Do we take these as a true representation of the meeting? Yep. Councillor Brown.
May I just make a comment about the minutes, please, at this time? As a new councillor, I'm surprised that this is not detailed, and the questions by myself and fellow councillors for this Overview and Scrutiny Committee aren't documented. It seems rather brief. There are a number of questions that were to be followed up, and they are not mentioned in the minutes. I presume they will be mentioned at next month's Health and Care Scrutiny Committee when the ICB attend again. Could this be documented, please, the lack of the questions and minutes?
Can I just ask what questions it is that were missing from the minutes?
Well, I know that other people did raise questions, but I questioned things like they were saying that one of the ICB members said that they didn't need certain diagnostic tests, and I questioned the fact that there was also the drinks. They said the drinks didn't need to be included, and I mentioned that the drinks were really important, especially for those who are more vulnerable and poorer. And there were a number of things that were to be followed up. And I know that Councillor Pert also made some questions as well, because I think we ran out of time. I just felt that there was a little bit of lack of detail in the minutes, and I think it would have been appreciated if we could have had more detail and possibly moving forward. And because it doesn't really reflect the scrutiny we gave at that meeting, and the public, when they read the minutes, they're very brief and can't really tell and understand that we were actually scrutinising and trying to understand what the decisions that were being made. Thank you.
And Zach?
Yes, so the minutes are, generally speaking, now backed up by the webcast that is published online and is also backed up, so then that goes on our website and then goes onto a YouTube that's there, and it doesn't, my understanding is it doesn't come off, so the idea is these are supposed to be backed up by that YouTube video for the more specific points. Were there any points specifically, questions specifically that are missing to add to the minutes now, or is it just a case to note for the future?
I think very much note for the future. I think we need a little bit more detail personally, and I think others might agree with this. But no, let's move forward. And as you say, there's clarification with people needing to review the webcast and things like that. Perhaps that actually needs to be documented as well, please. Thank you very much.
Okay, thank you. Councillor? I can't see the name.
Councillor Jones, thank you, Chair. I just wanted to I've got my hand up before Zach spoke, but I just wanted to say I've been on this committee a very long time, and I think I asked exactly that question. I think the first or second week I was on, and I got the same answer, and I'm quite content now, particularly now we do webcast, that, you know, what we do say is recorded, and you can always point people towards that if they want to know what happened. So, and I think that, you know, I know at our town council the minutes are a little bit more detailed, but even there we don't detail individual speakers. It's normally a flavour of the meeting, an overview, if you like, of the meeting. So I just wanted to back up what Zach had said and try to be of assistance. Thank you, Chair.
Okay, thank you for that. Can we, Councillor Norman?
Well, just in a sense to defend the clerk, but it is very difficult to do minutes, because if you say something and you're not mentioned, then that's a problem. You might think your question is important, all my questions are important, but even on my own committee at Lichfield District Council, they're not recorded. But it is difficult, that's what I'm saying. I think what we found at LDC was having bullet points of questions that were important, that there seemed to be some consensus about. But it's not an easy job, I know that. As a secretary, volunteer secretary of other things, I could tell you an interesting story, but after the meeting, perhaps. But I'm just, I don't want to suck up to Zach, but or you, Chair, but I did want to say that,
Okay, so can we take the minutes that have been recorded and the webcast as a true representation of the last? Okay, thank you. Okay, so I'd like to move on to section 4, which is the report of the SSOT from the ICB. So this is going to be
Sorry, it's not. It's a report of Councillor Robertson.
not pause from Councillor Robinson. I have the wrong information. So if you'd like to give your report, please.
Choice policies under discussion. The purpose of the policy is to ensure adults are offered choice and control of how their needs are met, as well as balancing the need for the council to commission care that is safe, effective, equitable and makes the best use of available resources. There are two main issues with current practice in relation to care home placements. Equality, the personal budget for people formerly living in their own home is set by the lowest price placements available, whereas the BP for people formerly self-funding their own care, home placements is set by the price of the existing placement, which is typically significantly higher. B, cost pressures in 24-25. This generated a recurrent cost pressure of 2.5 million. The policy's intention is to make people's entitlement to choice clear, to ensure consistency and fairness, and to assist the council to balance the interests of each individual with the interests of the whole population. The policy is different to existing council guidance and will be clear about setting practice in two important ways. The council will source a placement that meets the assessed identified care needs within a 25-mile radius of the adult's usual place of residence. The personal budget will be determined by the cost-effective placement that can meet the needs of the person. The adult will still be able to choose from other options provided the council or they can identify their own preference for a care home. However, if the cost of the chosen home exceeds the personal budget, a top-up payment would usually be required to cover any difference. The advantage of the policy is that it is a more equitable approach and will contribute to controlling costs. The risk of the policy are the potential for complaints and or for legal challenge and the impact on well-being from moving people. Projections are that on a current trend, i.e. without any mitigating actions, the cost of care homes, placements for adults aged 65 and over, is expected to exceed budget by 26.2 million by 2028-29. The policy would not be implemented without diligent consideration being given to the consultation feedback. Thank you, Chair.
Okay, thank you for that report. Does anyone have any questions they'd like to ask? Jill Hood.
Thank you, Chairman. This talks about choice, when in actual fact the choice is totally restricted by cost. I was deeply disappointed when I read it. So often I hear of my residents who come to see me and have an elderly person who they desperately need to get into some kind of a care home, some kind of care, and it is cost restrictive because they can't afford it, and top-up payments are few and far between. I'd also like to take issue with only 25 miles away. In Stone Urban, in my division, and I imagine a lot of the councillors here today, there are no bus services. It takes some of these elderly residents almost half a day to get there, and then they're not guaranteed how they're going to get back. and it's quite scary. And I am disappointed that we haven't delved into that. But placements are not a choice. They are dependent on the income of the family and how much that elderly person can afford. Thank you, Chairman.
Okay, if you'd like to answer.
Thank you. So we absolutely recognise that the policy that we've set out here is one that is under the national requirements we have under the Care Act 2014. That does mean that the council is obliged to fund, where people aren't able to pay for their own care, a care home that meets their needs. And in some cases, the needs that people have vary. So we completely recognise that if you have more intense needs, for example, in a nursing home, we can expect that we would pay more than if you didn't. We already recognise that. But there's a reality that we are buying care from an economy where many of the homes absolutely set their own price, as any business can, often to people who are able to fund their own care, and they can sell to other local authorities and they can sell to the NHS. So it has never been the case that you can choose and the council must pay for any care home that you would like, because the price varies enormously. It could be within a very small area. There are 2 care homes where if you were going there as a self-funder, you'd be making a personal choice about whether you're going to pay, let's say, £1,000 a week, a lot of money for your care, or £2,000 a week, or £1,500, and you'd make a decision. Now, we have to make a decision that's fair, and it's absolutely based on recognising that we have a duty to the taxpayer as well as to the individual. And those choices are incredibly difficult. They're really painful to make, they're really emotional to make, if you are a family or a person drawing on care, or if you're a social worker supporting that family, or if you're managing a budget, a huge budget. Yeah, we're talking about £150 million for older people's care homes, which draws on taxpayers' money. And when we fund that, of course, it has an impact for taxpayers. So how do we get that right? It can't just be that if you happen to live next to a particularly expensive care home, the council would be willing to pay 1.2 times, 1.5 times, twice as much as for people who happen not to. So there are some real dilemmas and challenges here. And we're trying to say, let's be as equitable as possible, but recognising that these choices don't therefore become easy. Now, the ability to top up is set out in the Care Act. We allow that because that's what's required of us. But again, if you have funded your own care, and let's imagine that you funded it for a period of time in a particularly expensive care home, of course you'd like the council taxpayer to pick up that cost when you can no longer afford it. Who wouldn't? But then again, it's a different question of equity. Because if we do that in every case, or close to every case, we may be paying much more for that individual than for somebody who did not have those assets and have not been able to make that decision. Across the country, many local authorities do make it very clear, as do we try to, for self-funders as well, about how to choose a care home and what to expect. So this policy is really setting out the kind of things that social workers need to do every day on our behalf, but trying to be as clear as possible so we can explain to people what to expect and the way in which it will work. We absolutely accept that that has an impact. The final comment I'll make, because I recognise this is building on Councillor Rogerson's work as well, is this is in consultation. We would expect, and we'd be surprised if we did not hear from people about the kind of impacts that you're discussing. And of course, Cabinet will be asked to take those into account before making any final decision.
I accept what you say. I understand you have to abide by the rules that this council has set down by the government. But that doesn't stop me, as a county councillor, feeling extremely emotive about the situation which I find many of my elderly people in, and we do not give them a choice. Many of them have no choice. Thank you, Chairman.
Thank you. Can Councillor Doherty?
Just touching on what Jill said about I don't think 25 miles is a reasonable distance, especially when I've worked in care myself. I've had those conversations with residents' families who are on low incomes, that have to work. They can't go and visit their parents or their loved ones as often as they'd like. And that also has a detrimental effect on the well-being of the resident themselves, especially residents that have dementia. So now, you know, going forward, is there any way that we could change that distance, that radius?
Well, I think the answer to that's the point of doing a consultation, and then the deliberation the Cabinet needs to make is the tighter you have that kind of radius, which is for, if like, a kind of standard expectation, the less likely it is that you have a range of care homes which are of a similar price to the average across the county. If you drew it very, very tightly, let's imagine it's within a few hundred yards, and then you pick the closest care home to that, then you'd get the position I described earlier, where it might just be if you happen to live next to a particularly expensive care home, the council taxpayer will pay more for that than if you didn't. If you go wider, you're more likely to set the budget fairly across a wider area. But exactly the point you make, if you have relatives who visit often, it becomes more difficult to visit. What we will do is we will draw out all of those issues, partly the reason for having this discussion today, and any comments that are made in response to the policy consultation. And then it is a deliberation between those. At the moment, that's more often done by social workers, talking with their managers, and just trying to be as clear as possible so we set a kind of normal expectation, I think is helpful in terms of clarity. There will always be exceptions. The policy sets that out based on individual needs and circumstances. And as I say, the final decision will be made by Cabinet, taking all those factors into account.
Can I just ask a quick question? So you've got a small radius. What happens if all the care homes that are obviously cheaper to go into become full, and you have a family that can't afford to go into the more expensive care homes, and they don't have the equity or anything to actually pay for that?
And if I can just introduce my colleague Helen Trousdale, who's authored this report and is the lead commissioner for older people and people with a physical disability or sensory impairment.
Hello. What we try to do is when we do an assessment, we actually identify what the person's needs are. And that's not just the person, that's their wider social needs, so making contact with family, how integral that family input is into their care plan, and how they... So we will always make a decision based on the individual's personal circumstances. But there are other options as well. For example, we have a carers assessment, which is set out in the Care Act, and we have carers grants that we can offer to people as well. And one of the things we're trying to explore is there a way we can support people with transport costs, which would still mean that someone could go to a far cheaper care home in terms that would meet their assessed care needs that's still within a geographical area, but the family can still access them and support them. So what the policy is very clear at is we look at the principles and we look at the individual circumstances. So it's not a blanket arrangement for everybody, but it's a framework that's fair and equitable that we work to. But in law, we have to look at the assessment and we have to look at the individual's assessed eligible needs to inform that decision.
If I might just add to that on the specific question you asked. We do have a legal duty to meet people's needs. If there are no vacancies at all and there's no vacancies that are coming up within a reasonable timescale that will meet those needs, then of course we need to look elsewhere. So we don't have a kind of theoretical price which cannot meet needs. The other thing that we do is we do have a process where providers tell us the price that they would be able to meet the needs for. If any provider bid on a price that was foolishly low, then we have a range beneath which we don't just accept it. We would ask some searching questions, so we would exclude any unrealistic, unsustainable prices. We have a wider legal duty under the Care Act to market shape. That means to ensure that there is a sustainable market overall. That's a difficult thing to do every year because we all know that the public finances are challenged. We need to spend money wisely, but we need to make sure it is possible to run viable care businesses in this county. And the price that the council pays is a big, not the only, but a big component of that. That doesn't mean that we have a duty to make sure that any business is sustainable at any price. It's a wider market duty. So within that, we're managing these complex dynamics to ensure that we meet people's care needs. But unfortunately, that doesn't always mean meeting them in the way that they would ideally like. And I completely accept the points that you're making. They're really valid. And the teams that we work with feel that every day. These are emotional decisions, some of the biggest decisions that people make in their lives. But we do have to make them fairly and consistent with the law that we have. What this is doing is being, as I say, transparent to help social workers be as fair as possible. That doesn't mean that the decisions become easy, and we don't pretend that it does.
Okay, thank you for that. Catherine, Councillor Brown.
Good morning. Thank you very much for that presentation. I've got to follow on what Councillor Hood has said. I think it's essential and possibly does need minuting for us because we're here to represent our residents. Firstly, I totally understand you have to save money. You have to work within the Care Act. You have to work within government policy. But we're here also to represent and scrutinise an overview. So the criticism or things that are said are meant with the best intentions because we have to be here and say them. I have to follow up with the distance issue. Rural Needwood Forest Division, we have a situation where we don't have many care homes. They're having to compete with other people for jobs. We have huge national insurance contributions now, other costs, everything we know about. So therefore, the chances are residents will have to try 25 miles. They've perhaps never been to Stoke-on-Trent, where there's probably a bigger volume of care homes. Their relatives have never been to Stoke-on-Trent. There are no buses. So are you really going to pay for taxis for their relatives? So it's not just distressing for the patients, distressing for the relatives, it makes it isolation. So those people won't have many people to visit. They'll become more isolated. I think the 25-mile issue that Councillor Doherty mentioned, I think that really needs looking at, and that's part of the consultation process, as you say. I'm actually going to just slightly finish and not ramble too much, but to say, I think it needs to be documented, please, if possible, to say, how is this consultation going out to residents in Staffordshire? Because quite often when consultations are put out to the residents, a lot of people don't know, don't hear and understand them. And I'm really concerned that the briefing, and I'm sorry I can't think the name, there was a briefing about this for the general public with a note and picture format. I actually feel it doesn't tell the picture that I've read in the policy that you've given. So I'm sorry for the criticism, I understand it, but there's so many things for rural Staffordshire that it's going to be terribly distressing. Thank you very much.
Just to pick up on what you're saying is, yeah, you know, we all agree there is issues, but in rural areas, there tends to be issues with placements close anyway. But, you know, I'm sure that the teams and everything will take every single thing into account, including relatives. But sometimes actually placing that person in the correct placement will exceed or up to the 25 miles. It's not always the case, but unfortunately that at the moment is how the things are going with nursing homes at the minute. But it is a very difficult thing, and we do take into account every single thing that you're saying, and we appreciate the fact that, yeah, this is what we're here for. We want you to scrutinise it and make sure that we've got everything correct or to the best of our ability.
May I just add to that, if that's all right? There are two versions of the draft choice policy. One is with lots of pictures. It's an easy read version. That's because that helps a conversation, for example, with people with a learning disability, but some people find that helpful anyway. And then the full version, which is a bit more technical. We're very grateful that you've invited us today because this is during the period of consultation. So all the points you're making are really important. And anything that we can do to publicise that consultation, for any means that people have got, we welcome that. There is a reality that's quite difficult here, which is we're talking about a policy that affects decisions that people are likely to be affected by in the future. And of course, often as we get older, we don't realise that the date at which we might need those decisions to be made might happen at any time. Yeah, some people do have that coming quite quickly, and surprisingly others many, many years away. So there will be plenty of people who perhaps are not engaging with this because they don't realise it might affect them yet. Whereas if you have a loved one who you're placing now, and some people have given examples there, they are much more likely to give us a really important feel for the issues here. What I would say, though, is many of the things that people would feel if they're going to be affected by this in the future are likely to be similar to the things that people are feeling now if they are going through the process of trying to find care for their relative or loved one. So every comment that is made will be read by me and the team and is presented to our political colleagues and decision makers. The decisions that are made are difficult ones, and they will be fully formed by the consultation, taking into account all the factors that we need to.
Thank you for all that. And as I say, I do understand, but I think we've got to shout out for our residents. I am concerned that currently I'm not aware, and I don't know everything, I put my hand up, but I know quite a lot of stuff. And I know that people haven't been sent 25 miles away in my division or in my local area. And also, I meant to mention before, I do think People's Choice, I think it's the wrong name. I don't think there is the choice. I think it's a good way of putting a spin on it, and I don't think it's the correct name. And also, you haven't answered my question of how the consultation is going to take place. Thank you.
On the specifics of how consultation is taking place, then we have publicised the consultation with a form where people can give feedback, and many people we know already are, and Helen can give a few details on that. So perhaps if I pass over to you for that, Helen.
We're running the consultation through the Let's Talk Staffordshire platform. My understanding is information has gone out through all of the council's social media links and also the citizens panel, and we've had, I think, over 200 responses so far to it. But what we can do is make sure that we circulate the link. It's being managed through the council's communications team. And, you know, please, the more responses we get, the more we actually want. So, that, you know, if members of this committee can publicise this consultation, that would be excellent because it would get us more responses. But it's certainly been out on Facebook, Twitter, the County Councils. It's live on the County Council's website. And as I said, the Citizens Residents Panel has also been responding to it as well. It's live for 8 weeks, I think, is the consultation period. So there is still another 3 to 4 weeks for it to be live.
Could we have that extended, please? Because obviously Councillor Hood and I aren't aware of it, and don't know. Is it how many people are aware of it in the room? And anyone aware of it then? No. Okay. So could we have that extended, please? Thank you.
We'll have to take that back, Andrew, because we're following the gunning principles, which are set out down in legislation for an 8-week consultation.
I'd like to move forward that could be a recommendation towards the end. Councillor Greatorex.
Thank you. I've got one major point and 2 minor points. If I start with one of the minor points, this whole thing about the 25 miles, I think it's a misnomer referring to the mileage. And I give you the example. I live in Lichfield, south of Lichfield. It's 21 miles away from here, and I can't do it in half an hour. And I notice on page 12 of the report, there is a reference to the blocked bed policy and referring to 30 minutes being acceptable for friends and family. Well, 30 minutes is very different to 25 miles. For instance, living in South Lichfield, I can get to Birmingham in less than 20 miles. But it takes a lot longer to catch a train or catch a bus and park up or whatever I choose as the means of transport. So I think you probably need to look at a combination of mileage and time. So that's the first thing. The main thing is the the whole policy is, there in principle, a very sensible one, because you referred to it being fairness and consistency. However, in terms of fairness and consistency, and I feel like quoting Charles Dickens and Mr. McCorber, if you've got the cap that's being set, which is basically what we're talking about, this whole idea of having a choice level that can be budgeted, if you exceed that, then it's misery. If you're under that, then it's joy. And so where that's set is quite significant, because if you're talking about just trying to correct a few outlying providers that are charging too much, then fine, you'll eliminate those and you'll make it a lot more straightforward. However, if the level is set such that most people are caught, it will be misery for more people. So I know we've got the figure of 5.5% or thereabouts increase last year, which is generous compared to inflation. What it doesn't tell us is how many people are being caught currently by what the personal budget set would be. And the last comment I would make, and there's a reference to it, it refers to transition planning needs to be put to mitigate impact. Now, I presume you're talking about transition planning to mean those people that are currently in play. So you're not going to suddenly say to somebody, oh, by the way, we've changed the policy, you're now no longer here, we're going to route you out and go to a cheaper place. I presume that's what you mean by mitigating the impact. However, in terms of transitioning, what I think needs to be linked is the previous comment I made, that the personal budget set needs to be set at the right level in order to not catch too many people, and then you transition, because presumably you want to save costs. Councillor Brown has already referred to the fact this is a cost-saving exercise. So there's obviously a drive behind that, and I can understand that. I can understand trying to correct the outliers, as I say, that are charging too much. But there has to be some form of transition that accepts that not too many people get caught by a sudden change to the policy.
Thank you. So lots of good and detailed points there. In the covering report, it is describing a change from a practice of a sort of normal view of what seems reasonable around a 30-minute travel time to the proposed 25-mile approach. And the reason for that is because when you get into the details of where could you get to and by what route within 30 minutes, it then becomes incredibly complex. So there is something that's much clearer about something like a geographical radius. And that's one of the reasons why we're consulting on that. The size of that geographical radius makes all the points that you say absolutely valid, because the wider it is, the more likely it is that there is a consistent price by which we set the personal budget. The personal budget must be set at a rate which is possible for a business to run sustainably, so we'll always do that. And in terms of transition, I think what we're talking about there is if you are coming to the council where you've been a self-funder and you've been paying for the care yourself, if the personal budget that we set is at a different care home, the way in which that move is managed obviously needs to be as person-centred as possible. It may well be that the care home that you're in is willing to match the personal budget that we set elsewhere. Some care homes would do that, but not all of them. And obviously we would welcome that if a care home did. But the way in which that move happens can be made less painful and less emotional. And obviously we'll try to do that. There are reasons why people do move from one care home to another all the time, often because their needs change, sometimes regrettably because a care home has issues around quality. It's no longer able to meet needs safely. So the teams do have a lot of experience in doing that as well as possible. The final comment I make is that there are always exceptions. There are some principles that are set out at the beginning of the draft choice policy that we believe are important. So there is always a professional judgment about risks that needs to be made. But again, we're trying to give as much clarity as possible so people have clear expectations and that we think is fairer and allows social workers to have difficult conversations in as consistent a way as possible.
Would you like to say something?
Yeah, it's just to reiterate that even if you've got a loved one who's in a £1,500 home It doesn't always mean that they're getting £1,500 worth of care. And sometimes people think the more that they pay for care, the better care they're getting. And that's not always the case. There's some good homes that have a cost-effective fee, and they give absolutely brilliant care. And sometimes that, as Andrew said, the changes in health, that home may not be suitable anymore, especially when you're dealing with dementias and living with dementia, as as they go down that journey, there may be a need for more advancements in care needs. Thank you.
It's Councillor Wallins next. I have taken your name down onto the list, Councillor Norman. Okay, thank you.
Cheers, thank you, Chair. I do have a couple of questions, but I'll do it over 2 parts. I think the biggest question with the 24-mile reasonable distance is, shouldn't the focus be investing on local provision rather than moving people far away? Because, same again, living in Lichfield, if you go west of a 24-mile radius, you got Stoke. If you go north, you got Derby. If you go east, you got Nuneaton. And if you go south, you got Solihull. So wouldn't it be best to invest in local provisions? Thank you.
So we do have that market shaping duty to try to encourage a good supply of care homes. And if it's a need where there are quite a lot of people who have that kind of need, we try to enable that to happen. There's all kinds of ways we do that. That includes by giving information to the market about future need and demand. We do that for something called a market position statement that we update fairly regularly. We updated the ones for Staffordshire for all of our care services about 2 years ago, and we're going to update them again by the early part of next financial year. So that's one thing we do to try to promote supply. We also try to promote quality. So we have in our council teams that not just do quality assurance of the services that we commission, but also of services that we don't. We offer that as well. And we offer lots of information and advice and good practice workshops to the whole market to enable them to improve quality. That includes establishing with Stoke-on-Trent and with the ICB a social care academy to really bring together training opportunities for the market, and that links to all of the themes that we see coming out of that quality assurance. So we make a big offer to the market to help them develop where there is a local need. Sometimes there are needs that is very hard to meet in a very local area. So supposing you have a very precise need, for example, Helen's team sometimes looks to meet the needs of people who have an acquired brain injury, much younger in life than many of the people who are placed into care as older people. So it's more likely that you perhaps have to travel a little further there to have your very specific needs met, and that will always be the case. But for those, the kind of care homes many people here would be familiar with, providing care to loved ones, older people, there's just a reality that we are not buying the majority of care, and there are different market conditions wherever you live in Staffordshire. If you live on the border of Newcastle and Stoke, then those care homes will be operating in a market where Stoke is a big player. If you're down the bottom of South Staffordshire, you're operating in a market where the Black Country is a big player, and so on. So we're trying to manage all these complex dynamics and be as fair as possible. In an ideal world, wherever you would be in Staffordshire, we would have the same personal budget that you would pay. But that's not the ideal world that we live in. So we're just trying to manage between all these complex dynamics and absolutely to try to stimulate and encourage providers to develop care homes where we can see that there is a gap. Across the whole of Staffordshire, there'll be more need for care homes for people with dementia, for example. There are some hotspots of where's lack, and that's how we give information to the market to try to overcome that need. I completely agree. If we had a good range of services spread fairly across the county, that's the best ideal for everybody.
Cheers, thank you. And the second part of my question I want to ask is, my biggest worry is, isn't this policy effectively creating a two-tier system for people who can afford and people who can't? And many families who are on less, lower income or sometimes claiming benefits are now being asked to stump up extra top-up payments. What are the protections in place to stop families being pressured into unaffordable arrangements?
I'm not quite sure where you're actually going with that one, is that we've already got a problem where there's possibly a two-tier system in place anyway, where the people that are paying in the private sector, sometimes that cost offsets what the people that can't afford to pay private put in. So the policy is designed to try and level out and make it a level playing field so that everybody has got a good standard of care, which comes within means of the council and everything else.
And if I might add to that, Helen might want to come in as well. I know that some colleagues in this room will absolutely be aware of this, but just so we're unambiguous, the opportunity to pay a third-party top-up already exists. That's part of the Care Act. We are operating in the reality under our current legislation where if you are able to pay for your social care, then that is what you do. It's not like the NHS where it's free at the point of delivery. The council is paying for those people who cannot or are no longer able to pay for their social care. So we are already providing and funding care in a policy environment where if you have a very expensive house that you're able to put towards the cost of your care, then clearly you have more choices available than if you didn't. It's also true that not everybody understands that. So for some of our residents, thinking ahead, being aware that you have to pay for your own social care can come as a surprise. And everything we do as a council is to try to make it clear that that's the reality that we are working in. Helen, is there anything you want to add? With your permission, I should say.
Okay, yes. Okay.
Yeah, just really with regards to top-up payments, about 3 years ago, we changed our contracting arrangements with care homes. So before that, we just contracted for the bit that we paid. And the arrangement for the top-up was a private arrangement between the family, the person, the wider family, and the care home. Even though we had within our contract some controls around that, so we said you can't just change that top up to whatever you want, you can't add on to it, etc. I don't think it did always work like that, if I'm really, really honest. So about 3 years ago, we changed to something called gross payments, and a lot of councils have done that across the county. That means that we contract for the whole of the price, including a top-up, and that top-up's agreed with the people concerned at the point the person goes in. That top-up is then controlled by our contract. So that means the home can't suddenly come and go to the family, if you want mum to stay here, you need to pay us an extra £100 a week. Or, by the way, we're introducing this, so you're going to have to pay for that because the council won't. And I think that gives an awful lot more safeguards than they were previously. I think one of the things that strikes me, I mean, and I've worked, most of you will have known me in Staffordshire for quite a long time now. If you go into a care home and say, what's the price of a placement here? Depending on who you are and your circumstances, you won't get a standard price from a care home. You know, the prices range within hundreds of pounds a week from what they offer people. What we use is a national study that's done every year called Lang-Buisen, which is the industry report on care home prices. And they give a range. So they will say to be financially stable, the minimum amount an older people's care home should be charging is this. The maximum amount is this. And they base that on, the minimum amount is based on a care home that's pre-existing, they've paid off all the mortgages, and they're dealing with maintenance, running and ongoing costs. The maximum amount is a brand new purpose-built care home that's still paying off their development costs, etc. And what we're doing within our policies at the moment, and we're currently out to consultation with care home providers for our new contract, is we're saying we want to use that range and we'll go for the medium, the bit in the middle, because that should cover most circumstances. So we're not setting our price range at a range that is below what the national report for the industry says is a sustainable rate for care homes to operate. Now, what we do know, because I'm talking to providers almost daily, is a lot of care home providers are not small businesses. They're large companies, they're owned by multiple companies as well. And I've been talking to providers and directors of these businesses who make no bones about the fact they want to realise between 25 and 30% profit. You know, that is a heck of a profit. And the only place they make that profit is from the costs that they charge, both to individuals and residents, and also to public funded bodies who are funding those placements.
Okay, thank you for that. Councillor Jones, I think you had a question.
Thank you, Chair. Just quickly support the 25-mile argument. I think in rural areas, even 10 miles is too much because you can't, there's no buses, very little transport, so even 10 miles. Also, I think in rural areas, the care homes in the rural areas tend to be the more expensive ones because they're in a rural area and it's a more desirable area, so they tend to be more, they can charge more. So that's a sort of double-edged sword. But nobody, as far as I can hear today, has mentioned numbers. What is expensive? What is the cut-off? What is it? You know, and I recently had to go through this earlier on this year with a relative. And all the average, just for the people watching, because I had no idea about costs, and I don't think most people do. We talk about £1,300 a week, just for care, not for any nursing. Around about 30. The average around Biddulph and the Biddulph area was £1,300 a week, and if you've got more than about I think it's £11,750 or £12,000 in the bank, you've got to pay that. There'll be no contribution. So I just wondered if somebody could clarify that, and how much is it a total contribution when the money runs out that the council will pay? Because even if you've got a lot of money, £5,000 a month is sooner going to mop it up. And there is already a two-tier system, and it's not the wealthy and the not so wealthy, it's the blooming wealthy, really out wealthy. There are only people that can do this. When you're talking about sort of near £60,000 a year for an elderly person that might be living there for 5, 6, 7 years, it's a lot of money. They're soon going to run their savings down. So I just wonder, and about top-ups, this is my final point, Chair. Top-ups, why can't top-ups just be defined so that, you know, once your savings get to below a certain point, the council will pay X. Not that they have to be in a particular band, whether you're in a £1,500 a week, or £1,000 a week, or £2,000 a week. Surely it could be a percentage at least, so that it gets paid regardless. So you don't have to move people, and families then can review and say, well, actually, if the council pay, I don't know, 60%, we can pay the rest. Is that not an option? Thank you, Chair.
Just to answer the first part of your question on how, you know, how costing and that, coming from the other side, which I have in that industry, sometimes the fees are not totally correct on the offset, and the reason being is it's through assessment. So if somebody was due for a release from hospital, they were well, but they're classed as end of life, it's assessed as end of life, and sometimes some people's assumption is that end of life is imminent, and it's not always the case. It can be 2 years, 3 years. I've had cases where people have been given 2 weeks and been there 5 years later, because the understanding of that. So when you go out to assess, it's about getting the assessment as close as you can to that person at that point in time, and that does change. So you may have somebody at £1,500 and they're quite unwell, they recovered, they're safe to discharge, and they come into a home. Then they start to get care that's conducive with getting more well. and they have to be assessed, and that's where sometimes the problem can be, is that the financial need is not as much as what it was because the care need is less. So that's when you may get issues where, okay, we can't pay that any longer because that need is not there. So they reduce it. You have to reduce the costs. For the other bits, I'll hand over to Andrew.
I'll just come back on that bit first, Chair, if I may. So end of life now, as I understand it, if they're giving you more than 2 weeks, you can't get it. It used to be 6 months, and now it's 2 weeks. Is that correct? That was what I was told.
Yeah, end-of-life funding, fast-track funding is what it's called by the NHS, is funded by the NHS. The criteria is that a person has to have a prognosis that, unsadly, they would pass away within the next 6 to 12 or within the next 12 weeks. That's the criteria. I don't know how they're managing it at the moment because there's an NHS piece of work doing. But I would say I am seeing people coming to us who are very, very poorly in care homes, who've been funded by the NHS for, because they have been determined as end of life, where they've extended, they've survived longer than that period, and the NHS funding is ending. And then they're coming to us. Now, obviously, those are the circumstances we were talking about earlier. We assess people. If someone is so poorly, we absolutely would not even consider moving them. But I was talking with some social work teams last week about a case where in the time that they had been reviewed off fast-track funding in the middle of August, to us having a conversation last week, the home has already triggered a new assessment for fast-track funding because that person has really gone downhill in that time. So there is a piece of work that's being done by the NHS. It's done by the NHS, not by adult social care, but I would say, yes, I am seeing people coming off fast-track funding who are extremely poorly.
I agree, thank you. Through the Chair. And it is 2 weeks, it's not 12. I can absolutely tell you it's 2 weeks. It used to be 3 months, it's now 2 weeks. And you're right, the particular person that I know about this through was in that position in March. And bless her, she's still here. And thank goodness she is. So I understand the difficulty, but the question, I don't know if you're going to answer it, but the question I wanted to know was, in this 25-mile radius, you've got to, if you want to get council funding, it's got to be within this 25-mile radius and within a certain cost. What is the cost? Where's the line?
So there wouldn't be an exact line because it would depend on your needs. So we have to be able to identify that there is a care home that could meet your needs. And of course, that would be more if your needs are more intense than for somebody whose needs are lesser. So it is based on that individualised assessment and then the most cost-effective price that we can get for the market. And that's one of the challenges for people because it's not a set price that we are willing to pay. On the contribution, the amount that people have in their capital assets beneath which they have to drop before the council will begin to fund is set nationally. So that's in national legislation. And at the moment, it's £23,250 is the upper capital limit. So when you fall beneath that, there's a slight complication, is that down to £14,250, you pay a sort of taper. But the rates at which we begin to fund as a council are set by law nationally. There have been many debates over the years about whether that's the right thing for this sector. Those debates around how adult social care have been funded have resulted in no change to that overall approach for many, many years. People in the room may be aware that there's currently a review for the whole approach to adult social care being undertaken by Damon Louise Casey. Who knows if that results in any change. But as things stand, we follow those national rules. So what that means is we do make the offer when you fall beneath those capital thresholds to say, this is what the council will pay, because we can meet your needs here, cost effectively to the taxpayer. But if you then want to pay more, there, and you can do as a family, or between you as a family, as a third party, then this is the difference that you would cover in an agreement. So that's not then set as a percentage, it's set above that threshold, because the threshold is set by national requirements.
Chair, if I may, so just for the benefit, again, for people watching, just to be clear, that threshold, that first threshold is £24,000, and then it starts to taper. And then at what point do you become eligible for full funding? Is that, as I thought, about £11,500, £12,000?
Excuse me, can I just cut in? Can we make sure that's the last question? We're short on time and there's other people that we need to
I
ask
accept that, Chair, but
questions.
these, for people watching, I mean, people have no idea what these costs are, and they're absolutely eye-watering, so I just want to get it clear.
Yes,
not for our benefit,
I
but
do
for
understand.
anybody's.
I just wanted to make sure that was your last question so I can move on.
I'm near enough finished now, Chair.
Okay, thank you.
So just quickly on the capital limits point, these national figures set for this financial year, £23,250 is what's called the upper capital limit, £14,250 for the lower capital limit. There's a means contribution for the bit between the two, calculated as £1 per week for every £250 of capital between the capital limits. Apologies, that's quite a technical answer to take in verbally. I'm sure I'd be happy to circulate the link to the national guidance if the committee members wish to read it there.
Chair, that was clear to me. Thank you very much. The other just a little point I wanted to make was about, we talked about care homes and occasionally we talked about nursing homes, and we seem to be conflating the two, and they are different. Does this policy apply overarching between both, and we don't say there's one thing for nursing care and one thing for social care? Thank you. Thank you, Chair. I've done. Thank you.
I can confirm that it does. It applies to any accommodation-based care where people would not be receiving care in their own homes. We sometimes say care homes when we mean either residential care homes or nursing care homes. There are different types of care homes. There's also something called supported living, but these are all circumstances where you'd be moving from your own home to another location where there's a strong connection between the place you'd be living and the care that you would be receiving.
Okay, thank you very much. Councillor Norman, I think you wanted to ask a question.
Thank you, Chair, yeah. Just have to say, it's a bit awkward for me, this scrutiny, because I understand all the arguments being put and the lack of realism, I think, on some members here, because obviously as a scrutiny we could recommend increase our cost 10% or increase it 20% or whatever. But the reality is the situation we all find ourselves in. Now, the policy also talks about care at home, which we've not touched on, and that's an important thing because, in my experience, most people want to stay at home if they can and look after themselves. That's not possible, but that's their first choice. But the policy does refer to that. One little question was about on paragraph 14 about the distance that's been mentioned a few times. Presumably it doesn't include public transport, having some sort of an idea of the lack of public transport, the availability of public transport in there. So that's just one thing there. The block booking, I mean, I think you've touched on it, but those people, self-funders, actually do subsidise somebody in the next room sometimes because of the block booking that the county council is able to do with care homes. Now, the self-funding, 5 years ago, 6 years ago, it was £23,250, the figure there. It has not changed in 5 years at least. It's quite amazing, really. And I will certainly let everybody have the Age UK leaflets on fact sheets on this to give them some interest in that, because I used to work for Age UK and advise on care homes and nursing homes and that. Except that when it came to my dad, I suddenly realised it was much more complex than I thought. Oh, this is what you do. These are the rules. Just quote that. You've got them. But in fact, as it's been pointed out, I think I went to 3 different homes for my father because, well, you know, we can't manage that. Well, you know, we can't manage it. And so did end up a place equidistant between myself and my sister. She's in Warwickshire, Dad was in Warwickshire, we're in Staffordshire. An email to the top person at the LGA who was involved with the care there got them to see that all I'm asking for is for you to follow the rules. It wasn't a special privilege, although a personal email was given to me. I said, no, I just want you to know these are the rules. And it was an excellent home, but it took a while to find. But I'm surprised that we don't seem to be giving, I can understand the difficulty, saying to self-funders that if you go here, in the future, which is what I used to emphasise to them, to the relatives really, that you may not be able to stay in that home And I presume the mitigation that you talk about is whether that person could stand moving again. But now hearing about the gross payments, that is great. That's something that we didn't have a few years ago. So that's excellent. What else was I going to say? Planning, you get a lot of care homes being applications in for planning, and say, how can you vote against a care home? Well, it's not in the right place there. How can you vote against a care home? Well, you do know that it's going to cost $2,000 a week to stay there. Yeah, they didn't realise that. They say, yes, it's being against the care home is terrible, but then they realise they're not the ones that's going to be able to stay there. That's something that comes a bit of a shock. And as for the consultation, I think try and get it to emphasise it to people who are younger. Not, you're about to consult relatives and that now, but it's the future ones. The reason I'm in a bungalow is because working for Age UK, you could see the future. And it's quite right. Bungalows, avoid the steps now. So that's good for myself and my wife, who has particular scars from social services on your side in the past. So some comments there. I mean, I think people need to educate themselves on what the reality is. I think it's good. Okay, you can always consult more and give more time in that. But then the questions I really had was really about the distance, whether public transport should be in there to be considered at some point. And also the wider the consultation for people that look into the future, not realising what the future might be like, is, I think, important, as well as just those in that situation. Thank you, Chair. Thank you.
So did you have a question or?
I know that's a difficulty with what I was saying, but it's about the public transport there and whether that's considered in the distance. And then, well, there's a recommendation. Do you agree? Consulting as wide as you can.
Certainly, we welcome wide consultation. The draft principle we're consulting on is more about setting a radius, and we'll take into account views on that. Helen also mentioned that there may be possibilities around using carers grant to mitigate some of the impact of doing that, but we'll take views and we'll share those views, and Cabinet will then decide. Obviously, Cabinet will take into account the views from this committee as well, and just on helping people stay at home, we always want to do that where possible. We're able to set very consistent pricing for people who stay in their own home, because you haven't got the complexity of the buildings and all of that. And absolutely, one of the advantages of this, although we recognise all these really important emotional impacts that it has, and it really affects people in the real world, is being really clear that, as is the case now, if you decide to move into a care home, we can't guarantee as a council that we can continue to fund at that rate. So you do need to think about that. One of the things that can happen variably up and down the country is, if you're really clear about that, sometimes people who are self-funders may choose to move into a care home before they really need to, and that's a huge financial decision as well. So the more we can get good advice to self-funders, the better, to help them make these big life-changing decisions.
Okay, thank you for that. Councillor Luca, I think you had a question.
Okay, first of all, thank you for your presentation this morning. And what I would actually like to say, I think my councillors are actually far too much focused on the wrong questions this morning. I mean, shouldn't it be a lot more about actually how the quality of care and how actually this 25 miles opens up the correct bed for the need of the person, not about how relatives have to travel. I mean, so I really don't get yous on that one. I mean, because it's not about the relative, it's about the person that needs the care. Now my question is under this 25-mile radius, how many more beds which are actually needed, will it actually open? And what are going to be the things put in place so we do look at actually keeping the person as close to home as possible?
Probably the best way we could try to do that over time is to give some examples, because, of course, depending where you live, the radius makes more of an impact as to how many additional care homes it potentially gives access to within that standard policy. I do absolutely agree with the point around promoting quality in the care market. In an ideal world, every care home would be of really good quality and able to meet a wide range of needs at a fair and consistent price. We aren't in that ideal world, but we want to get as close to it as possible.
Okay, thank you.
My colleague is offering to add a clarification if that's helpful, Chair.
Yeah, that's fine.
So just to give you a practical example, because we're in Stafford, so I can tell you a bit about the care homes in Stafford. There are 4 that I can think of off the top of my head, care homes in Stafford that provide residential care and nursing care for older people, whether you have dementia or whether you have physical disabilities. Now, I know of those care homes, their prices range from one care home still in Stafford, so still within this town, that charges around about £1,000 a week, between £950 and £1,000, depending on the person's needs. There's another care home that standard price starts at £1,400 for exactly the same service. There's another care home, if you go out on the Stone Road, charges £1,700 starting price. There is another new build care home just outside of Stafford. Their starting price is now £1,900. There is not a cigarette paper you could put between the care. They're all rated as good, and the service that they offer is almost identical. But the range is absolutely extraordinary. Just in, 16 square miles, something like that, that you can go from a business that says, okay, we can turn a profit and deliver good care for £1,000 a week, to a business that's saying we can only turn a profit and deliver good care at nearly £2,000 a week. Now, for me, that's somebody else's care home placement. And we are getting to the position where we'd have to seriously think about how many people can we afford to place. Now that to me gives me even bigger concerns, because I'm then worrying about how do we make people safe if we're having to keep them within their own home. How do we support their families and their carers who are informally caring for them in their own home with that greater risk? Okay.
A follow-up? Yeah.
Also on the 25 mile, obviously, we've got LGR coming. I mean, which we're having forced down the next by central government. What is actually the ongoing plan for when that does actually get integrated, if the county does get split up?
So we recognise now that some people who live in the border areas of Staffordshire, a care home that is well priced over the border works very well for them. And we do contract with care homes who are in other local authority areas on the same terms and conditions that we set for care homes within this area. And then my team will do the appropriate quality assurance, sometimes liaising with the relevant local authority as host authority. So from that point of view, LGR shouldn't make a difference. It is inevitably the case, depending on the model of LGR that may happen, that you have different authorities that commission in different ways with slightly different terms and conditions, different pricing structures, and all of those things will need to be worked through by any incoming new authorities, and we will help them to do that. But in the meantime, we continue to live in the world where we recognise that the decisions made by other authorities around our borders also affect the choices that we're making right now, and we've taken those into account in developing this draft policy.
Okay, thank you. Anne Edgeler, I think you had a question.
Thank you, Chairman, and thank you for your presentation. Yeah, I've got 2 questions, actually. The first one is, knowing that people are paying this amount of money, which is an awful lot of money when you're talking about £2,000, £1,500, do we ever go into these homes and do a check to make sure that the money that people are spending is spent correctly and the people are getting the services that they should be getting? You know, I mean, we do that sometimes. We used to do it in children care homes, and I'm wondering whether we do anything like that. The other question I've got is, moving forward, how is this county council going to cope with the budget, knowing the amount of people over 65 over the next few years is increasing? And I wondered how you're going to cope with the money situation. Thank you very much, Chairman.
Thank you. So on the first point, we have a team in my area called the Quality Assurance Team, who do carry out a programme of visits, and a team called the Provider Improvement Response Team, who particularly do that for care homes. The Provider Improvement Response Team includes nurses who are seconded into our team and are clinically supervised by the NHS. So that means they've got really good clinical skills that they have and can access in looking at the quality of care in those care homes. The teams will look at the experience of people, they'll look at some example practice of the way they care for people, and they will look at many of the documents that they have. Of course, because we don't commission the care for people who are self-funders, it's very difficult for us to say that a particular price that's been charged for a self-funder is proportionate with the service that's been delivered. What we can say is if somebody is not getting the care that meets their needs, then we can either identify that to the care home to improve, or we work very closely with CQC. We will make them aware, and sometimes CQC will impose a requirement to improve that care. I should add within that, of course, many of the things we find when we visit care homes is examples of good practice, but sadly there are examples of practice that does need to be improved, and that's why we have the team. And apologies, I've forgotten the second question. I'm so sorry, Councillor. Oh,
about the budget and knowing the
forward.
number of people that's going to need care, and it's on the increase over the next few years. You know, how are you going to cope with the money situation with the county council?
Thank you. So aware of time, I won't give a very lengthy answer, but there is a strategy for older people that Henry's team have put together for social care. That's in the context of wanting to do everything we can to help people to live healthy lifestyles, all of the public health work we've got, working closely with our NHS colleagues to avoid risks where they are avoidable, like having good quality falls services, because that can avoid some of the risks around falls. But there is a reality that there will be more older people who will need care, sometimes intensive care in the future. We should celebrate that we have more people who are living longer. But there is a reality that is going to be care needs that need to be met. That's why we have a medium-term financial strategy, and it is looking at that we want to set a policy that allows us to meet care needs in a way that is cost-effective but does meet those needs. For all the reasons we've discussed this morning, this is all part of us thinking about the future. How do we get that balance right? But we can't ignore the fact that more people are going to need care. It's a great thing, but it's a thing we are going to have to deal with and plan for.
Okay, thank you. Councillor Brown.
Thank you. Just to come back on just a few points, really. I do believe with Councillor Williams, I do think there's a two-tier system, and I think you hit the nail on the head when you've got a varying difference for care homes in Staffordshire. And if the cheap ones becomes full and the expensive ones only available, then obviously that puts more pressure on the relatives and everything. I wanted to pick up about the dementia patients. I think a relative that has a patient with dementia, it becomes quite obvious that they need to move care homes. So I don't really think that's the best answer when you consider the amount of volume of people who don't have dementia and their relatives are going to have to worry about them moving or having to go to a different place or 25 miles away. And actually you also hit the nail on the head, I believe, that there are large care home providers, and those are going to be in the conurbations or peri-urban areas like Stoke. So again, that does mean that our people will have to move further away from the rural areas. And I think there's a disparity here between those councillors who live in urban areas who have care homes near them and those who do live in rural areas. And I think to say that there's a lack of realism by councillors or that councillors don't understand what's going on, we do understand what's going on, but we know what's happening in our area for our residents. And to just say that we're wrong, I don't think that's very nice, and I think it's rather disrespectful. So what I would like to say is I do think please do look at this, and I think it's really important.
Can I just say that, you know, we are open for debate here, and, you know, he made a point that obviously the point of view from his side would be to look more at the care for the people rather than the families, and that's the point he was making. So let's sort of keep this on the situation that we're talking about rather than...
Yeah, if I just quickly come... But that's it. It's a personal opinion, but I don't think it should have been... other councillors should be criticised. But also, a relative that goes into a care home, part of their needs and care is met by those relatives and those friends who go into the care home, who stimulate them, take them out. But if you can't even get a bus, which is what's happening, to a care home in Stoke. But thanks very much for listening, everybody. And I realise there's about 6 of us who obviously have got issues over it, but thank you very much.
Okay, Cabinet Member.
If I just come back to your point about dementia and people living with dementia, this is where, as a proprietor or a fit and proper person, is getting the assessments right at the beginning. Because if you've got somebody living with dementia and they're going into care at an early stage, then that proprietor, that home, that manager needs to make sure that that care can carry on all the way through the journey. And, you know, that's what, as I did, I aimed that, look, depending on what the dementia is, let's look at the future. And then that, if it does stop this, well, we can't cope now, we need to move. That is very bad for somebody with dementia. But that's also has to be reflected as the care goes down.
Okay, thank you for that. Councillor, do you have any follow-up questions?
No, thanks for that. But yeah, I know about the dementia and all that, and that's what I'm trying to say. Relatives understand when they have to move to a different care home when they have dementia. You know, it's the social worker and everybody explains it, and I think it becomes quite obvious to them that they have to move for that reason. So I wasn't against you on that. It was a case of, I think they're a small proportion of the people we're currently talking about. But thanks very much. Thank you. I think it's good for everyone to understand.
It wasn't that. I was agreeing with you that the fact that if we got it right, we wouldn't need to move. That's what I meant if it wasn't clear enough.
Okay, Councillor Bentley.
Thank you, Chair, and thanks for your presentation. I've listened to everybody's questions and just waste time going over most of them. But on a slightly different note, keeping people at home, you know, I listened to you on that one. And I wanted just do a little bit of it. I met some Australians on holiday, and I says, what do you do? He said, oh, build houses. Like, I said, oh, well, he says, yeah, well, he said, we'll build care home villages. He said, we build like a full job, the bungalows, the hospital and everything. I know we're a bit far off that. So I'm just thinking, do we think for the future, you know, I've just heard that they want to make 25% profit on some of these care homes. Why aren't we building a care home and making our own profit? So that was one of the things why we're not thinking that way. And the other one was keeping people at home. We in the Moorlands, I love watching the planning applications, and you see people put in for a planning application because they want to build a granny flat in the back of the garden or whatever. It's like the end of the world. Try to get that passed. So to me, if we are trying to keep people at home, we as the county should be supporting some of these applications to allow that. I don't know how we make it work, but you can see where I'm coming from, can't you? You know, if you know you're going to have an issue going down the life, one of your parents is sadly gone and the other parents looks like they're going to have some sort of issue. Do we start the process a little bit earlier? You know, is there anything there that we can plan for? So I know we probably rambled on a little bit, but can you see where I'm getting to? Thank you.
I'll answer the part about planning. There is a lot out there that if you know you're in that position that you can plan for care home fees, and it's called annuities. But that again is down to personal preference and affordability, and if that road's taken, whatever the investment and return on will pay for care all the way through the life, including increases. I think I'm correct there, aren't I? Yeah. So there is a lot that, you know, the ageing population, and for younger people like yourselves, well, I'm excluding myself from that, is to prep, because we are living longer. And, you know, there's a lot of affordable ways of doing it, and annuities is one of them.
Okay.
It's a question if the committee wished to in its work plan, be very happy to talk about all the things we can do to help people stay in their own home for as long as possible. But without prolonging the debate, because I know you've got limited time, I can assure you we work very closely with the boroughs and districts. We have a joint housing with care strategy. We're looking at a needs analysis in every area. We put out information to encourage the building of extra care where there is a demand. We're just updating a profile on that, and we're working with our borough and district colleagues around promoting good quality standards for thinking about older people within their overall planning cycle as well. So lots of work around the kind of things that you're describing there to help people live in their own homes for as long as possible.
John.
Come back on that. Prior to me being a real councillor, we had a care home in Cheadle that was run by the county council. Unfortunately, somebody decided it wasn't fit for purpose. There was absolutely uproar in our town. and now it's just a pile of bricks on a site that nobody's ever done anything with. So it is a bit close to home for us in Cheadle, because we had this little care home where we had lovely county council staff that looked after it. Everybody seemed happy. They had a bit old-fashioned, but everybody was happy. So we seemed to race that one through. And then obviously we also have an hospital in Cheadle that, I know it's slightly different, but from people out there that don't fully understand, we've got an hospital with like empty corridors, and we're struggling. But I don't know. I would like to talk to you after the meeting about what you've got planned in our area for, if that's okay. Thank you.
Okay, thank you for that. Councillor Doherty.
Yeah, just going back to your point of home care provision. As an example, my auntie, she had a fall and she broke her neck. She was in hospital for about 12 weeks and she was discharged home. And then in came NHS care. So she's put money aside for her care in the event that she would have to go to a care home. But now, because of the level of NHS care she was getting, which was absolutely appalling, she's now decided to use that money to pay for private home care, which is 100 times better than what she was receiving by the NHS. So I suppose my question is, we need to look at our NHS home care because it's not good enough, and people are having to pay, you know, they're using their money to pay for private care because the NHS care isn't good enough, and then that in turn, she's now going to have to go into social home care when the time comes, and she won't have a choice in where she goes because she's had to use her money for private care.
If I may, Chair, if there's any specific circumstances that you have that are not appropriate to share in detail within a public meeting, I'm very happy to give you the address of our quality team, and they will always share concerns with our NHS colleagues that we work closely with. That's the same for any committee members. We have people who are working in social care up and down the county who provide excellent care and give their all. But there are definitely examples where that isn't the case. When we do, we need to know. And if that relates to another commissioner, we will share that information with them so that they are aware.
Okay, thank you very much for your question. Councillor Hood.
Thank you. I am more than qualified to discuss elderly care. I have chaired Age Concern Stoneham District, which gives its services totally free. I have chaired it since around 2009-10. I have seen every equation of families lovingly coming to us and talking about the needs. I have seen families coming to us who can't wait to shove that person out the door. And I have also met residents who have no one, and I mean no one. They are desperate, they're isolated. And Councillor Luca, when you talk about the 25-mile not being a problem, it's a massive problem. Many of our isolated elderly cannot possibly afford or have the capacity mentally or physically to travel 25 miles. That's all I'm going to say about the 25 miles. What I would ask, and please forgive me for being so blunt because I know we're short on time, as in the old days, do you still call the care homes to tell them that you're coming for your assessment team?
I've never known when the assessors are coming out.
I have on a number of occasions.
Yeah.
I just want a yes you do or no you don't.
I've just said no.
Fine, thank you. Thank you, Chairman.
If I add, there are certainly circumstances where we do call. So that,
Well, you just said that you don't
that homes are aware. There are also circumstances where we may visit unannounced.
Excuse me. Councillor Hood, can you press your mic? Sorry.
That's my experience in the management side, as I haven't known and usually it's a courtesy call and they'll come in and have a chat, blah, blah, but I have never known myself personally.
A courtesy call, so that will tip them off straight away. I know in extreme circumstances you'll have relatives who will call into our office and say, I'm extremely concerned about what's happening. We always say to them, call social services. Social services are totally overwhelmed. Totally overwhelmed. They don't have the staff, they're compassionate, they're hardworking, you know, and it's really sad. But you've answered my question. You do sometimes give them a courtesy call, so I'm sorry. Absolute waste of time. That is not an assessment. That is forewarning. Maybe a home that has a problem, we're coming in today. And I've heard it happen lots of times. Thank you, Chairman.
I'd just like to remind everyone to press their buttons and please don't speak over speakers when we have them. Okay. As you address Councillor Luca, I think he wants to reply to you. So I'm just going to let him have his reply and then we'll move on.
Okay, Councillor Hood, to respond to what you said, scrutiny is all about, we mightn't agree with each other what we're saying, but we're here to get facts. Now, I'm not going to agree with something that I see is not actually the main issue. The main issue to me is making sure quality of care is what we're getting, not how easy it is for relatives to get. Yes, that's important. I'm not disputing that, but that is not the fundamental of what this is about. This is about making sure for the 25-mile distance that we get the correct bed for each patient, not about how easy it is to get the relative to the place. Right? So I even had the decency not to mention names, but I'm not saying, yeah, that your argument actually isn't, I mean, doesn't have fundamental. What I'm actually saying is scrutiny is all about facts. Okay.
Now, if there is any issues in future in the meetings, I think if you want to address each other directly, it should be done outside of the meeting. Okay, thank you. I think Councillor Wallins wanted to ask a question.
Thank you, Chair. And a lot of councillors have mentioned about transport links to, especially in the 24-mile radius. You know, I remember Councillor Catherine Brown, Councillor Jones, and a few others all mentioned about transport links. And unfortunately, I don't live in a rural area, so I can't really speak on that behalf. But I know from Lichfield, there isn't direct transport links to Derby, Solihull, Coventry, Stoke, Telford, without going to many places first. My question is, when assessing people to send into, to find the best place into care homes, does transport links, take into account? Is it done sensibly? Instead of taking someone, for example, from Lichfield to Coventry, not taking like half a day to get from Lichfield to Coventry, especially for the people who don't drive and so forth. Hopefully that question makes sense.
So that has been current practice. The draft policy we're consulting on is suggesting as a standard practice, for which there'll be exceptions, looking at care homes within a 25-mile radius. So some of the feedback I'm sure we'll be getting is exactly the point that you're making, that may be more or less difficult depending on whether there are transport links. Trying to calculate it by individual transport links is difficult because, after all the points you've made, depending on when you wish to visit as a relative, might make it harder or easier, because for some areas public transport is more limited, some people have their own cars. And again, the comment that Helen made earlier is in some circumstances using carers grants might be a way of allowing people to be able to travel in a way they wouldn't otherwise be able to afford.
Okay. Councillor Brown.
Yes, I'm so sorry to come back on this, and I realise... Would you like to go first then? I'm happy for that, of course.
Just two small questions. I'm going to go back a bit because it's about the consultation. 200 isn't very much in a county of our size, and I haven't seen it, and I do look on social media. Could you possibly let your colleagues in the district councils, borough councils and parishes know? Because we all have we have a community cafe every week. We get 60 elderly people every week, which we run as the parish. We're perhaps a bit closer to some of our residents and the county councillors, I don't know, but, you know, particularly the parishes. If you could let us have that, then we could certainly perhaps distribute it well, and I think that would be useful if you could do that, please. Right, thank you. And just the other small point, you mentioned a little while ago, sorry, can't remember. Sorry, you mentioned a little while ago about the issues faced specifically by rural homes. I'd be interested to know what issues those were more than in urban areas, if you wouldn't mind. Thank you.
I think it was through the lack of care homes in them areas and also staffing. Rural areas tend to be a bit of a problem because staff can't get into work. So that's probably why sometimes it is going to push up to the 25-mile mark. That was all.
Thank you. Councillor Brown?
Yeah, I just think perhaps I was misunderstood earlier when I mentioned the relative. It's not just about the relative travelling. If you can imagine a person who hasn't got dementia, hasn't got exceptional care needs, but the family can't cope and they need to go into a care home. And I think a lot of people understand what I'm saying now, but because of some of the comments, I think it's really important that I do say a bit more. A person goes in, can we call them the patient, into the care home, and there's lots of lovely staff and they do what they can, but they're short-staffed and they're busy, and the person needs a bit more help. So they might need a bit of help with feeding, at meal times, at drinks. They might need help taking down to into the room for stimulation, or into the garden, or the relative might be able to take them out for the afternoon or the day. And as they get older or more unwell, that might continue. But part of that stimulation is absolutely invaluable. So to say it's just about distance and travelling and inconveniencing the relative, there's a lot more to it than this. And I think it's a really important area that stimulation allows that person to stay well, mentally and physically, for longer. And I don't think it's just about inconvenience to a relative having to travel to someone. So I just felt it's really important. And I don't think I'm the only one that feels that way. It's a much more complex issue. And I think until you see relatives and friends and hear all their stories and live where you do in a rural area, I think it's a much bigger deal. Thank you very much for listening once again.
Thank you. And just to confirm that we absolutely understand that the links that an individual has are unique to them, and people benefit from that in their own individual ways. So we recognise that it does have an impact for everybody involved. That's why we are consulting on the policy, because we recognise it has an impact. We obviously invite all the comments we've described through our consultation, but we also know from every day our social work colleagues are talking with families about the as well, so we absolutely recognise that.
Okay, thank you. So I'd like to have the last question from Councillor Bentley, please.
Thank you for that. This is not at you, this is just an observation. I've just had to go outside because I had a phone call, and it was my father, and he's 85 years old, and he lives up the road. He lives like 12 houses up the road. And you know why he lives 12 houses up the road? Because I built an house 12 houses down the road, so I was next to my father. And on Friday, my wife had to go and get his shopping from the local Aldi, and he has to have the certain beans and the certain this and the certain that. And that's part of a community, isn't it? It's part of family as well. So it is both ways. You know, it's all right to say to these guys, I can't understand how we can enforce 25 miles one way or the other, because if there isn't a care home, I don't know what we're going to do about that. You know, it might be geographical, there isn't one. But I also think if you can help we should be helping ourselves as well. And you go to some of these, what we call backward places and backward countries, they do this a little bit better than us, believe it or not. They do plan for the future, i.e., grandparents up the road, move them further closer. And like you say, if we can't put them in the garden in a granny pod, you know, should we be planning? I'm not saying everybody can do it, but if the people who can do it are encouraged to do it, and
Councillor Bentley.
Sorry. Sorry.
Can I just say that I think we should move on, and I'm going to talk to you afterwards. Okay.
Thank you.
Thank you.
And I completely agree with you on that as well. And that's what's happening for me personally, but completely understand. And I agree with your planning and everything as well. Thank you.
Okay, sorry about that. Okay, so thank you for attending and presenting your reports and answering our questions. Please, can you send us the link to your... Please, can you send us a link to your consultation, or we'll recommend to you to extend your consultation for further, like how many weeks should we, as a, we're going to extend for another 4 weeks? So can we, is it okay to vote on that? Can we put, is everyone happy with 4 weeks to extend?
Sorry, I think there might be a legal problem here. Excuse me, there's a legal problem here, isn't there? But is there some way that you could actually perhaps reset it? Because we've all basically said we're not aware of it. So I realise there's a legal obligation, and I think that needs to be looked at, doesn't it?
So the recommendation of the committee is entirely up to yourselves. I can't agree to that as an officer. What I'll do is as always, we take the recommendations, and then Councillor Rogerson will then consider them and reply to them. It's not been difficult. I just can't make a decision based on that.
Is everyone happy with the recommendation to move it forward for 4 weeks? Okay, thank you very much. Okay. Thank you so much, Cabinet members. Thank you for coming down and talking to us. I appreciate that. So we're moving on to item 5, which is the Freedom to Speak Up update. This is the report of the SSOTICB, and welcome. So Tracy Shewan, she's the Director of the Corporate Governance, and she is going to give us a quick presentation. Okay, thank you.
Thank you, Chair, and good morning, councillors. For those who perhaps aren't aware, the previous committee requested that we come every 6 months just to update on the Freedom to Speak Up processes that are in place at every NHS provider. They actually came on the back of the mid-staffs inquiry that we should have Freedom to Speak Up guardians in every NHS organisation. I think the reason the previous committee wanted us to come every 6 months is following the Lucy Letby issues. Pardon? 12 months, gosh, doesn't time fly? Following the Lucy Letby issue was to ensure that these processes are in place with every NHS provider. So this is our update. I'd like to thank the Guardians who have sent me their update from each of the provider organisations. As you can see, we have the Guardians in place. There are champions in place in each of the organisations, and there are several things that they do to encourage staff to speak up. The main issues that we do see, though, are from staff raising issues about how they've been treated, whether that's by other staff, patients or visitors, and that seems to be the theme that comes through. Differently, though, this time is we're seeing that more from our overseas colleagues, and we've seen that in a couple of the organisations. You can see how it has progressed, and you can see actually that the increased amount of people that are being able to speak up because they've seen action being taken following them speaking up. The other thing I just want to take note is following the Penny Dash review, who is the chair of NHS England, there is a recommendation that the National Guardian will be subsumed into the Department of Health. Obviously, there will legislation be required to do that, but that has been a recommendation. I'll stop there, Chair, and I will hopefully be able to answer any questions, but as I say, the Guardians have updated me today.
Okay, thank you very much for that. Councillor Norman, I think you wanted to ask a question.
Yes, but it's certainly concerning about the overseas staff. Having been to Walsall Manor and New Cross and various other places recently, quite a few times, it wouldn't be anywhere without the overseas staff. So it's just frightening that they're under that pressure. My question, though, is on the, and I can't see any information on this here, about speaking out. What I've also observed, and I know from with GPs where you've had this letter, no, the letter's not been sent, or I should have sent that letter, inefficiencies, whether, these are all important, but I was also interested in people could speak about when they see inefficiencies. Well, if I did this instead of that, or if you did that, you know, it would make it a lot better. So I am particularly concerned with that, and good ideas that somebody might have, and they say, no, not, you know, you're only a junior member of staff and that, so we're not interested. I just wonder if there was encouragement to come up with any suggestions or good ideas. I always remember the Monty Python, the Holy Grail, where Michael Palin there makes a suggestion and the whole production line collapses. But outside of that, I think there is good reasons for that. But just want to be reassured of that, although it's very serious, obviously, on the HR side of things. I understand that. Thank you. Thank you, Chair.
Thank you. And yes, the separate processes in place for people to make suggestions. I think you have got our operational plan again coming back on the 20th of October. And from there, you will see things that people have raised with us. Certainly as an ICB, we have a suggestions page on our website, intranet, and I know the big providers do, and I'd like to think that staff feel free, because they're the ones who actually can see where inefficiencies absolutely are, so hopefully they can raise them. I can go back and check, but certainly I can assure you that in our organisation there are processes in place. Just want me to respond to that? This. Oh, I was going to say, because this is just about freedom to speak up. We do have complaints and the PALs, yes, yeah.
Okay, thank you so much. Councillor Edgeler.
Thank you very much, Chairman. Thank you, Tracy, for your presentation. It's just a question really for the committee. My understanding is the government leave table now, Midland Partnership Foundation Trust and No Staff Combined have come out as two of the top organisations that's doing a lot of good work, and they've come out in the top 5, I believe, and it would be good for this committee to write to these organisations and thank them for the good work they do, but I put it to the committee and to you, Chairman, whether we should do that.
That is definitely something we can look at. Sorry. Councillor Wallins.
Thank you, Chair. I've got 2 questions, but same again, I'll split them into 2 parts. The ICB has only 2 guardians for 500 staff, but how much is this costing the taxpayer overall, and what's the actual return?
It won't be costing the taxpayer anymore. Somebody does this as part of their role that they're already employed to do, a bit like you would get a trade union officer who would do that as part of their role. So there's no extra cost to the ICB or the taxpayer. It's part of somebody's job. And I'd like to say that I would feel, certainly as a registered nurse, I would be expecting everybody to speak up. That's what I'd expect. But actually, in terms of their role, they do it as part of their job. And I manage one of them, and they're allowed time off to do this work.
Thank you. And the other question I got is, you admit there's an action gap between staff raising issues and action being taken. Isn't this proof that this scheme is just painting a pretty picture? And also, can you give one clear example where speaking up led to real change and not just another report on the committee? Thank you.
Okay, yes, I'll only speak for the ICB in terms of give an example. Midlands Partnership Foundation Trust have named, they've got several examples, and I'm sure all the other organisations have, but I won't speak on their behalf. So for us, we had an issue around medicines management, That was raised in a freedom to speak up, and that was then taken, and action was taken, and change in how the policy was actually executed did actually change. So there's things like that. In terms of the staffing ones, they usually go around a HR route. You usually find that somebody does freedom to speak up, they get to talk about their issues, and the Freedom to Speak Up Guardian then can advise them accordingly, and hopefully then they get into a proper process so they can actually have all their issues dealt with. And that's what's happened mainly with the ICB. And then when general practice, they've tended to be contractual issues, so therefore we work with the contract in order to make the changes there.
Just one more thing to add, Chair. On about HR and management and so forth, shouldn't we be streamlining HR and management and creating another layer of bureaucracy if in relation to the two guardians and so forth?
Yeah, I think this Freedom to Speak Up Guardian is anonymous. It's an anonymous approach to begin with, and I think that's really important. Wouldn't it be lovely if we had the confidence that everybody would speak up, use the right processes and policies, and not feel scared at all? But we know from some of the issues we've seen in inquiries before, that hasn't always been the case. So this is kind of like a catch-all for those who may feel concerned about raising their issues, which sadly, you know, that does happen. But hopefully what we can do then is talk to the individuals, work with them so they can get into their processes. So for me, this is an added extra, which brings about better staff experience, but also better quality of care.
Okay, thank you very much for your questions. Councillor Greatorex.
Thank you, Chairman. I do have a question, but a bit of background. I do employment tribunals, so I'm used to seeing various people where they've got very strong views and bring them to the fore. And this whole cultural thing is quite strange for me, having worked in various industries, brewing industry where there's a lot of blokey atmospheres and very different attitudes to how people are dealt with when they've got complaints or comments. So I tried to get the feel of why people are raising these issues, and each paragraph is slightly different. UHNM NHS Trust, for instance, 1.4 says it's all about whether action's being taken, and there's this 2 action gap 2 campaign. So that's all about whether action's going to come from it. The word futile is there. Is it worth raising things? The MPFT NHS University Trust, they've got 2.2 safe, confident and feeling that they can make suggestions. In other words, it's all about safety, whether they feel comfortable to do it. North Staff's combined healthcare, they're referring to inappropriate behaviours and managerial issues. So there seems to be lots of different strands that are coming in different trusts as to what is behind people feeling uncomfortable. So my question is, and the suggestion, if you like, is how do you go about giving feedback where good practice is taking place? So, for instance, if you've got employee ideas coming forward about how to improve practices and people feel uncomfortable to whistleblow, and again, I know about protected disclosures. Does that get trained into people? Do people understand what protected disclosure is all about? And are there examples where they're given feedback to say, this happened anonymously somewhere, but we've corrected it? And similarly with, I'll call it bad behaviours, does that get fed back anonymously? We've had an issue, it was dealt with this way, somebody came forward and we've dealt with it all, you know, politely and under good controls.
Okay, thank you, Councillor, and all good comments within that. And they are different. I think organisations have different cultures, so different issues will come to the fore within that. I'd like to say I hope that they do promote protected disclosure, but I think you're correct that over 12,000 staff, would they all know what protected disclosure is? Probably not. So, you know, that's something I can feed back to them to make sure, you know, is this in the induction training for staff? Because freedom to speak up is, so they could quite easily talk about protected disclosure there. I think in terms of feedback on positives that have worked, every single freedom to speak up action that comes in has to be reported to the National Guardian's office, and the Guardian then is actually, within the organisation, has to feed back to the individual on what they've done, what action's been taken. And even if there's sort of an explanation of no action being taken, that still has to be fed back to the individual. Because sometimes, and I think in an employment tribunal you'd probably understand this, if people are not willing to give evidence, it's really hard to take a formal action, but you can gather themes and start looking at things in a different way. So hear all your comments on that. They are different organisations. I will say to them about good practice. I haven't actually seen any of their recent sort of leaflets they've got on freedom to speak up, but it might be useful if they can share them, and I can send them on to Zach.
Okay, thank you. Do you have any follow-up questions? Okay, Councillor Brown.
Thanks very much for coming to talk to us. Thanks for the presentation and the information that you've sent. A bit of, obviously, experience in this area, having worked for 35 years in the NHS. It's an excellent thing that was obviously brought out of something really bad, following the Francis report. But I would like to say that, yes, it does give real change for individuals. And I think it is cost effective because it allows people to be retained when they've got issues. They don't look for another job. But I think there's more work to be done on that. And protected disclosure, although there is training and it's often mentioned freedom to speak, I think there's possibly a lack of those actual examples. And I think that actually then will give people the confidence to speak out. And one of the issues that is mentioned is the bullying issue. Bullying, I think, is probably bigger than is being addressed currently in the NHS. And I think that's why so many staff are leaving. And I wondered, in 12 months' time, could we focus on something like bullying? And could we understand what numbers are being involved in all our trusts? And how many cases, what happens, where and how? And I think a bit of feedback, getting a bit of the meat out of this, what sounds like a really, I can't think of the word, pretty policy. It does work. I know it works, having been a union rep. So, yeah, it does work. It's fantastic. I think we need a bit more meat on the report to understand the bullying. I do think it needs looked at. And I think within the trusts, they need to be feeding back of who comes who speaks out confidentially, but what happens if it can be said to the staff to give them confidence. Thank you. Sorry, I hope I haven't gone on too long again. Finish.
Thank you, and thank you for all your comments. And certainly, I'm not going to be sitting here, I'm not a HR manager with all the HR data, but that's something I can take back. And certainly I know you do have workforce presentations here, and maybe something around the actual HR elements instead of just workforce numbers. May be helpful to you, because there's also the sickness rates, there's everything else that they monitor. So yeah, I will take that back. And thank you. There is more to be done. There's always more to be done in any of these campaigns. You probably see from year on year, there's extra being done. There's more guardians been taken on. They've done more work, more campaigning. But we never sit on our laurels. There's always more that can be done. So thank you for that.
Okay, thank you. Any follow-up question? And Councillor Luca.
Okay, first of all, I completely agree with what Councillor Brown just said. And the reason why is I've got 2 sister-in-laws which are currently training as nurses, and my own wife is actually training as doing a master's in occupational therapy. So what I want to ask, because I know there's bullying going on with student nurses, incident I will give you is where they've gone in on their placements and the staff want to use them as gophers. I mean, and obviously when they've turned around and said that's not what I'm here for, they've had a right go at them. So yes, completely, like I says, completely agree that there is a lot more to do, and I understand that you are stepping up and starting to put things in place to protect them. And also, as my wife and obviously my sister-in-laws are also African, you hear the racist card a lot. Now, the question I want to get to is a 2-part. What are we putting in place moving forward for zero tolerance, and also the guardians, obviously their identities hidden. How many of the middle managers and top managers in the trust know who these people are, so they can't put pressure on them?
Okay, thank you for that. And I'm sorry if your family are feeling pressures of bullying, and that shouldn't ever be acceptable. I think there is a zero tolerance to bullying. Easy words to say, but you do have to carry out actions and call it out. And it's not just down to the individual who perhaps feels bullied. I think people who witness it should call it out too. I'm a nurse. I strongly believe that. Sadly, in some cases, that doesn't happen. I think in education, in your personal cases, there's also the education route that you could go down, that they could speak to their university, because basically it is a zero tolerance. People should not be being bullied, and certainly during their training, they shouldn't be bullied for turning up to do their placements at all. So, please feel free to use those routes. In terms of the guardians, I expect that a majority of the managers will know who the guardians are. If I sort of speak to Rob or to Kath, Rob's at UH&M, Kath's at MPFT, who they are, I'd expect a lot of the managers to know who they are. They wear green, they do these things so people do know who they are, and they are on this intranets. And we have, as I've said in here, we have group meetings about that, and they've never raised an issue saying managers don't know who they are. Sometimes they've been challenged by the managers when they've been trying to talk to them, but the managers do know who they are. Yeah. I think that was all your points made.
No, what I was actually saying is, obviously their identity is supposed to be private, kept secret. So what I'm saying is, how many of the middle managers and senior managers have their names and can use that opportunity to put pressure on them?
Apologies, Chair. I read the wrong question. The individuals. So I know I've been involved in freedom to speak up, and if you have to have a conversation, you don't say who's raised that name. I certainly don't. It's confidential. Also, if the guardians speak to me, my guardians come and speak to me, I don't know their name. I don't know the name of the people that are raising the issues, so they shouldn't know. The thing is, if it is an issue and you have done something wrong, you probably know. But no, the name is never used.
May I just come in on that, actually, and support you on that? The Guardians' names are well known. The staff who are involved with the Guardians team are well known. But I really feel, with the experience I have, that the Guardians are known, but the confidentiality is huge. And only at the point, the person involved who's brought the complaint, only when they say that you can, is their name released to the manager if they need to down the line of the policy. But confidentiality is huge, and I have no qualms by saying that. I do agree with you, and I think it's really safe. And I think if it wasn't, I think that's a huge, huge problem. But I don't believe it's there in this instance. I've never come across it. I think it's an excellent system. Thank you very much.
Claire, any follow-up questions, Councillor Luca?
Yeah, thank you for obviously that clarification. It's just my concern is if a trust isn't doing well, too many managers knowing who these people are could use an opportunity to hide facts and information, which would have a knock-on effect to obviously keeping good staff and also the quality of service to the patients. That's my concern.
Okay, thank you very much. Is that everything? Yes. Okay, thank you. Councillor Carver.
Thank you, Madam Chair. If I may, I would like to return to the point that was made by Councillor Wannans. This, in particular, the guardianship aspect of the Freedom to Speak initiative. I mean, the entire initiative sounds really good. But I don't accept the point that the guardianship aspect is free. Because you say that you do it you get time off work to do it. Well, if you're taking time off work, then someone else needs to be doing your normal duties, if I assume. So, just, you know, I understand that. I mean, nothing's free in this world. But let's just say, for example, you work 40 hours a week, say. How many hours a week do you allocate to this initiative, if you don't mind me asking? Thank you.
Okay, so each organisation's different. So if you have a look in the report, you'll see some that are paid, because when you've got 12,000 staff, they have a day a week off to go around to the different wards, go and talk to different staff groups, do inductions and what have you. So that's in with the different organisations. In terms of the Integrated Care Board, because we only have 500 staff, it is part of two people's day jobs. So when I meet with them, so they'll meet with me for half an hour every month. So that's half an hour every month. If they've got no cases, they've got no cases. And in the ICB, there aren't that many cases. You've got 500 staff, you haven't got 12,000 staff. So you wouldn't expect that many cases. So if they have got a case, then maybe they're talking to an individual. It could be 1 or 2 hours a week. But it's all dependent on what's going on. I wouldn't want to have somebody taking up 1 day a week for 500 staff, because they wouldn't have the time. You know, they'd have time on their hands because there's not that many issues. So in terms of each organisation, it's really what's needed to do the job. And I do think it's a valuable part of doing a job. I think freedom to speak up is a valuable job. It's a valuable system. And I think, you know, in terms of is it value for money, then only the staff can tell. And obviously, we do get these things raised with us. We do get concerns raised with us. So to me, that says value in itself.
Thank you for that. I'm not denying it is good. What I'm saying is that when you spoke to my fellow councillor over there, you said it was free, and like I said, you know, nothing's free. So I'm just trying to get a gauge of how much it actually costs the taxpayer. Thank you, Madam Chair.
I couldn't actually work it out in pounds, shillings and pence as I sit here today. And like I say, it's variable. In terms of the working it out, I haven't got a calculator, but I could work out for each organisation, if it's a band 7 at 0.2 whole-time equivalents, we could actually give you a figure. And but I wouldn't, you know, and then we can put it against how many we've got, but I can do that for you. But in terms of the ICB, it's very different, because that is just what it needs to do the job.
Thank you, Madam Chair. Yeah, if we could, just as I say, it's just when you said that, kind of my ears kind of went up at it. But yeah, if we could kind of get a sort of a figure just approximate, that would be really cool if you wouldn't mind, please. Thank you, Madam Chair. Thank you.
Okay, thank you very much. Councillor Edgeler.
Thank you. It's been answered, Chairman. Thank you.
Okay. Councillor Wallins.
Thank you, Chair. And yeah, I do agree with what Councillor Carver has said about getting a report and so forth. Yeah, that'd be really great. The report says most concerns are about bullying and staff behaviour. Why is it taking whistleblowing for management to do its job properly? And will senior management and HR and all the other relevant areas will be held accountable if they fail to act when staff raises issues?
Yeah. Yeah, basically. And that's why we have things like employment tribunals, and why we have all sorts of different policies. So, you know, if people are found to be failing in their job, or people are found to be bullying and harassing people, there are policies and there are consequences to those actions. Yes.
Cheers, thank you. Thank you, Chair.
Okay, thank you very much. Councillor Brown. Councillor Luca.
Yeah, again, I completely support what you're doing to try and actually give the staff a voice. I am concerned about the increase in, let's face what it is, racist attacks because of someone's background. It shouldn't be tolerated. What these people have to understand is, without these people, we wouldn't have a functional NHS. And to be perfectly honest, whichever, like when we had they come over to drive the buses, they all serve a purpose. Now, what my question is on that is, what he is actually doing exactly right now to support these people and to reassure them that this is not allowed and it will actually be basically scrubbed out.
Thank you, and I don't think any discrimination or harassment on any grounds is acceptable at all. There's a total zero tolerance. In terms of our overseas colleagues, there are special programmes when they come and join us in how they can settle within organisations. I haven't got all the detail with me now, but there are very specifics in order to support people, and certainly back to my Royal College of Nursing days, I worked quite a lot on international recruitment back there and what we can do to try and help people settle and understand the differences that we've got as well in our communities. And so yeah, there is quite a lot being done to support people, but no, it's a zero tolerance to any sort of discrimination, bullying or harassment.
May I just say something on this point? It's because it's relevant. Just to say, on the internet for UHDB, when something happens that might be classed as people might feel uncomfortable from certain groups, it does actually have usually quite often an article, a link to give that support if people want to go forward and take it up if they're feeling anything, especially if there's something in the news.
Okay, thank you very much. Is there any more questions from anybody? Councillor Doherty.
Yeah, I just wanted to ask, does this extend into care homes as well? Is it across the board? Or is it just within?
Okay, thank you, Chair. No, it's just within NHS providers currently, and over to general practice. That's been a recent sort of extension. Okay. I think there are other ways of raising issues within care homes, and certainly, you know, if somebody from a care home phoned our Freedom to Speak Up Guardian, they certainly would take notice. So, you know, if we ever received a contact, we would tend to get it, rather than Freedom to Speak Up, probably just through our switchboard or through our different sort of receptionists. People do phone up, or actually through the complaints and pals. So there are times when issues around care homes are brought to our attention, but it's not particularly for Freedom to Speak Up. But having said that, probably some care homes will have something similar. It'll depend, because of course they're individual businesses. But this is just for the NHS policy that has to happen.
Okay, thank you so much. Is there any other questions? Okay, thank you for your presentation and answering our questions. Can you provide us with the costing information and include more information in next year's report? Is that okay? Thank you. And we'll note the contents of your report.
Detail the report for bullying for next year as well, isn't it?
Yeah.
So we can understand one example within the Freedom to Speak.
Okay. Okay, thank you very much. So, and thank you very much for your presentation. Thank you. So now we're moving on to item 6, which is the work programme. So, yeah, I'll hand you over to Zach.
Yeah, so it's just for the committee again to note, approve the work programme. The other thing that members will hopefully have noticed is it's at the moment provisional, hoping that you're going to agree to having a new meeting, an additional meeting being added in on the 10th of November. This is to allow the operational plan and savings delivery plan to be considered by the committee on the 20th of October. So if committee are happy with that proposal, that is written as it currently is within the work programme, and then I can get all that sorted.
Yes, that's fine. Thank you for that, Zach. Okay. Is everyone else okay? Yeah. Okay, thank you very much. And that will conclude our meeting for today. And thank you everyone for coming. Thank you very much.